You know, David, I never thought I would be standing inside a giant colon, but we are inside an inflatable colon with Dr. Matthew Kalady of the Cleveland Clinic, Colorectal Surgeon, and you're going to kind of walk us through this colon and what it looks like to have a healthy colon and when it's not so great, right?
Right. So the biggest point here is we want to try to stop colon cancer from starting. The colon's a great teaching tool, and I think people, anytime you see a big inflatable colon, the natural instinct is to walk right through it, right? So you have normal colon tissue here, just kind of nice, pink, healthy tissue, and then cells get a little abnormal, and as they get abnormal, they become little lumps or bumps called polyps. And it's important about the polyps because this is the stage we can really intervene and take them off through a colonoscopy before they develop into cancer.
Okay.
As more changes happen within these polyps, then you get cancers. And then once it becomes a cancer, there's a different kind of treatment to that.
So that's what the cancer would look like inside the lining of your colon?
Yeah, it can look like this or some of the other pictures around here behind us as well.
Okay, and yeah, so that's another example as we move to the other side of the colon. And then talk a little bit about Crohn's disease, because that also can put you at a risk, right?
Right, Crohn's disease is an inflammatory bowel disease, along with ulcerative colitis. They're two different things. It's an inflammatory disease. And unfortunately, that puts you at increased risk for also getting colon cancer more than the general population.
So I don't think we typically think of colon cancer as a younger person's disease, but there has been a bit more of it showing up in ages 20 to 49, and unfortunately mortality rates too. Do we know why that's happening?
Well, we don't know exactly, but it's a great point. So colon cancer has always been kind of thought of as a disease of the elderly, and younger people tend to blow off symptoms and think it's not going to happen to me. The incidence in the older population has actually gone down because we do screening. People at age 50 you're supposed to get a colonoscopy. So as people are adhering to these guidelines, our rates are going down. Younger people, we don't screen that early. And unfortunately, we've seen this rate go up. We don't know why. We think it might be something in the diet, something in lifestyle. But the key is really trying to identify who are those people that are at risk so that they can get screened and cancer can be prevented in those people before it happens.
And how can you then, of course you talked about screening, but prevent colon cancer? Is there something in your health and your diet, the way you eat?
Sure, so there's some things you control, some things you can't. So there's some people who have family histories, and that's hard to control because it's already, the die is cast for you, but things you can do to help prevent things. So diet and exercise. In general, less red meat, low fat diet, high fiber, fruits and vegetables, things that you kind of think of as good common sense for good diet, and exercising regularly. Those things have been shown to help decrease your rate of colon cancer.
And who's most at risk?
Everybody's at risk. If you have a colon, you have a chance of getting colon cancer. The things are, again, people who have a family history, so if you're anyone, brothers, sisters, mom and dad, even grandparents have had colon cancer, you're at a little bit increased risk, and your screening maybe starts at a different time. The other thing is that most of these cancers develop through symptoms ahead of time. So if you have a change in your bowel function, you might see a little blood, things like that. That's not something to just ignore. It's something to talk about your physician with, because that may be an early sign where you're still at a phase where you can intervene and take care of it before it becomes a cancer. Well,
we have a great run coming up this weekend that helps to raise awareness for people who have had colon cancer and for, of course, getting screening. Can you talk a little bit about what's going on?
It's a fantastic event. It's called the Undy Run. I think it was initial takeoff of the Indy 500. It is now the Undy 5000 or the 5K. It's down on the East Bank of the Flats. It's sponsored by the Colon Cancer Alliance, which is a national organization, and locally sponsored by the Cleveland Clinic. We're doing a great event. It's awareness, it's campaign, it brings out family and friends. Really just a fantastic event. It'd be great to come out. Everybody come and join us on Saturday.
And you've seen it grow over the years in participation?
This is the 5th year now, and hopefully we'll get about 1,000 people this year. It's a truly fantastic event.
Definitely. Bringing awareness, and the proceeds do go to a good cause?
Correct.
Great. All right. Well, thank you so much, Dr. Kalady, for spending time with us, walking me through this giant colon. I've learned something, and I hope you all have too. We have more New Day Cleveland coming right back after the break.